Wonderful. So we'll get started here. We're talking about how to be tobacco free or how to have freedom from tobaccos and understanding why quitting smoking is really the single most important decision that we can make for our health. So let's hop right on in. Whether you've sort of started your journey here with us with step one, saying maybe you want to quit today, or maybe you're here as a healthcare provider to help your patients quit smoking, or as a loved one that's concerned about a family member, or maybe you are trying to quit yourself. Maybe you have quit and you just want some additional support. No matter where you are in that journey, I'm happy that you're here with us today, and hopefully we can give you some more information. So we'll explore sort of what that journey looks like for a lot of folks. We'll explore why do we smoke, the motivation that has to come behind our quits, cigarettes in the human body. And then we'll talk about how to start a quit smoking plan, how to deal with the obstacles that come along with that. Of course, we will talk about the benefits of quitting, and then how can we stay quit for good. And then we have some additional resources at the end of our slides here. And I'll leave a little bit of time at the end if anyone has questions or concerns or wishes to share maybe their experience. I find that sharing our experiences really is where we make the connection, and sometimes that will push someone to making a change. So your input is always welcome. To start off, I want to see sort of where you are in the journey, or where you think your loved ones or your patients might be in this journey. There are a couple different stages of the quitting process. So I'd actually like to start with a little video here. Let's try this.
Hi, I'm Dr. Mike Evans, and I think quitting smoking is a journey.
Lee, can you hear that?
For some, it's a short journey full of resilience.
I can hear it.
For most, it's a long journey, a long affair, if you will, of quitting a complicated relationship that can have as much to do with a person's relationship with themselves as with the cigarettes. What starts as a pleasant sensation, opportunity to rebel, or even to belong, is replaced by less pleasure and a feeling of being trapped. A daily or hourly ride of nicotine withdrawal, and then another cigarette, which brings relief. Most teens who smoke think they will quit in their 20s and actually don't till their 40s. Stopping smoking is about making a change, and that is something we're not too good at. I think of change, I think of two concepts: where you are at and the mechanics of how we change. So we should start where you are at. When I started medical school, I thought I could take somebody who smoked and convert them into a non-smoker in one fell swoop. Now I see it differently. I focus on where the person is at. You may be in what we call pre-contemplation, where you're not really even thinking about change. Approximately 75% of smokers want to quit, but 25% are not interested. Maybe you're at the contemplation stage, thinking about it, but not quite ready to act. Next is preparation. This is critical with smoking, especially in the likely event that you've tried to quit before. What has worked in the past and what hasn't? What caused the relapse? Maybe you're at the action stage. This is when you're ready to make your move. There's never a perfect time to quit, and at one point you just have to jump. I'll tell my patients, hey, it's going to be a challenge now, and it's going to be a challenge in 5 years, so why not do it now? And finally, there's a maintenance stage where you become a non-smoker and are trying to stay that way. When we make changes, it's critical to stop and think, how important is this change to me, and how confident am I in making this change? What we call your self-efficacy. Your job is to be honest. My job is to see if I can move your scores towards 10. The concept is about the different parts of change. So there's the what. What are we changing? With smoking, I suppose it is straightforward, stopping. But if you think about changing lots of things, I think it is like a relationship breakup. You start by just keeping things simple and low risk. You might break up your routine a little bit, avoid certain places, maybe use that juicer every morning to distract yourself, but you will need to change more than your smoking to stop your smoking. This is the why. Why change? I feel like I could do a 10-minute video just on all the medical reasons why not to smoke, and they are legion, but I'm going to spare you, partly because in clinic, I actually spend more time asking people what they like about smoking, which sounds funny, but I think we have to recognize there are positives, or at least perceived positives. And I think it's important to reframe these perceptions if we are to make a change. So let's run through a few of the common ones. Cigarettes are my friend. They de-stress me. They relax me. I'm not going to deny that you may feel a sense of relief and satisfaction when you have a cigarette, but I see it a bit differently. Addiction. The nicotine in tobacco is highly addictive. Within a few seconds of inhaling, it travels to your brain, causing you to have a temporary high. Over time, your brain changes, causing you to smoke more to get the same effect. Rate your addiction to nicotine with a few simple questions. Do you smoke more than 15 cigarettes a day or smoke within 30 minutes of getting up in the morning? Do you find it difficult to go more than 4 hours without a smoke? The power of nicotine comes from the repeated small doses you give yourself when you smoke. It may seem innocent at first, but if you take 15 puffs from a cigarette and smoke, say, 20 cigarettes a day, that's 300 drug doses a day. You think smoking relieves your stress or is satisfying, but it actually isn't. The cigarette is just making your nicotine addiction go away. Concentration better. It just calms your nicotine receptors cry for more. Smoking makes your heart beat faster, increases blood pressure and breathing. These are all symptoms of stress, not stress reduction. Let me repeat that. The cigarette just reduces your nicotine stress, not your real stress.
I think that video, it's a 12-minute video, but I do think it's very helpful. And if you guys want to go after this, go to YouTube, it's Quit Smoking Journey, and you can see there's so many comments here. And all of these comments are people that say, hey, wow, this really helped me. And I want to help other people quit smoking too, and you can do it as well. So I highly encourage you guys to watch the rest of that video. I think it'd be very helpful. But ultimately, we were trying to get at what point in the journey are you in, or what point are your loved ones in? Are we in the pre-contemplative stage where we're not really ready for change? If you're in this stage, you're probably not even on this call. Maybe your family member's on this call though. And you can identify, yeah, my husband's there. He's not really ready for change, but I'm ready for the change for him. Or maybe that's your patient. You're trying to pull them along the rope to maybe get them to that contemplation stage. My hope is that maybe through our conversation today, maybe we can make some forward progress, but it is important to know that no matter what stage you're in right now, there's always opportunity for forward progress. So knowing where you start at is a really good point though, to begin our journey. So let's continue on. Why do we smoke? So nicotine, of course, we all know is addictive, as we've seen a little bit in that video. That nicotine is the physical dependence. It changes our brain chemistry, in fact. The psychological reasons also come along with why we smoke, though. As we've seen in the video, a lot of people go to it because it's a stress reliever, or they stay smoking because it is a stress reliever. It's very habitual. It's a mood regulator. Some people even started by saying, hey, it's a way for me to control my weight. I don't want to gain weight, and I'm worried about that. Even in the 70s, when we were marketing cigarettes, they would say, oh, the Virginia Slims, they would help you lose weight and stay skinny, and they'd have the nice, tall, thin model on the packaging to get you to smoke their brand. So that does come along with it a little bit scientifically. Nicotine is an appetite suppressant. Ultimately, though, the downfall of gaining a little bit of weight with quitting smoking isn't as high of a risk to your health as continuing smoking. But other reasons why people might have started smoking in the first place was it was a very social activity. Of course, back then it was a little more socially acceptable. Now it's less socially acceptable than it was in the 90s. You would probably even come into the hospital in the 90s and the doctor would come into your room smoking a cigarette and say, hey, you had a heart attack? Well, let's go ahead and try to fix that for you, right? But no talk about smoking cessation. The doctor smoked himself. The nurses walked up and down the hallways smoking too. Of course, you will not find that nowadays. So our times have definitely changed. It's being a little less socially permissible now, but now we do also have a change with e-cigarettes that are a little more socially acceptable, especially by our younger crowds. So we'll talk a little bit more about e-cigarettes here in a little while. Ultimately, though, 3.5% of people really have success with a cold turkey quit. And the reason behind that is a cold turkey quit only adjusts one thing, and that's the nicotine addiction, and it stops it very abruptly. So you'll have a lot of symptoms from that, and a lot of people can't combat those symptoms from stopping so suddenly. It also addressed maybe the behavior a little bit because you're stopping completely, changing your behavior. Ultimately, it's not a very helpful thing for most people because I can't go from today saying I don't do any sort of physical activity to tomorrow saying my goal is to run a marathon and expecting to get to that goal within a month. Probably not going to happen. Maybe some superhero people can do that. Most people can't. So consider that whenever we're talking about quitting, and cold turkey does work for some people, but for the large majority, it doesn't. Ultimately, 75% of smokers want to quit. 40% of them will make the decision to do that this year. So the key is really finding the balance between addressing the physical addiction and the psychological reasons behind why you as an individual smoke, and then overcoming those barriers to quitting. So one thing that we can utilize is this motivation to quit. What is our motivation? Are we here because we have a concern for our health? Are we here because we have a concern for our family members' health? Or are we here because we just know it's time, we have to quit now? So this exercise that we're going to do now is called decisional balance. And it's very helpful for moving people along those stages that we talked about in the beginning. So it's a 4 squared box where we talk about, firstly, what is good about smoking? And Dr. Mike talked a little bit about it in the video, and I completely agree with his approach. It's something that we have to address with our patients, because I know you didn't start smoking because it was completely terrible and you thought it was an awful idea. You started smoking because it was a social thing, or it was a stress reliever for you and you needed an outlet. So those are the top 2 things that I hear about people about, why they started smoking. Some people started smoking back in the military when they got cigarettes in their rations. So it's a very common thing, or was a very common thing when you were growing up, like in the 70s and the 80s. So then we move from what are some good things about smoking to what are some good things about quitting. So that's the bottom right-hand box there. The good things about quitting might be you want an improved feeling of well-being, or you want to improve your health. You want to be able to breathe easier. Of course, saving money comes along with that. We want to reduce the risk of health concerns in the future. So we moved from the good things about quitting into maybe what's not so good about quitting. What are the barriers that you're worried about? A lot of people say, that loss of the coping mechanism. I have stress. This was the way that I dealt with it, by lighting up a cigarette. And now you're going to take that away from me. So what am I going to do? My stress is just going to go up. And in the video, you heard Dr. Mike say, smoking isn't helping reduce your stress. It's just masking it. So identifying that might be a really big concern for you is, I don't have that coping mechanism anymore. We can explore some other coping mechanisms that will be more beneficial to you. A lot of people also say it's stinking hard. It's hard to quit. Like we already discussed, it takes a lot of time and effort, multiple efforts to actually commit to it. And then, of course, we talked a little bit about the anxiety and stress component. So we move from those 3 categories up to the top right-hand category, which is, what are some not so good things about smoking? And usually this one is the one that everyone can list a lot of things under. It affects my health, my lungs, my heart. The cost is going up. The smell is awful. It's less socially acceptable. I don't want to expose my loved ones to secondhand smoke. There's not really a lot of places that I can go and smoke anymore. So that one we fill up quite quickly. But then we look at our list and we say, okay, if this was a check or a list of checks and balances, the scale of justice, if you will, the green side on the right-hand side of your computer there, it's a little more heavily weighted. There are still some things in the gray side, though, that are keeping us there. Everything on the gray side is keeping us stagnant. It will keep you in the current stage that you are in, whether that's in pre-contemplation or contemplation. Everything in the green is kind of keeping you exactly where you are, or I'm sorry, in the gray. Everything in the green is going to propel you forward, though. That's going to compel you to move to that next stage. So if we can more heavily weight that green side, we would be more likely to make that change. So we look at this then and we go, all right, what in the gray side of things, the good things about smoking and the not so good things about quitting, what are those things in that area that we can maybe address or remove from that side? So we talked a little bit about stress relief and that coping mechanism, the loss of our coping mechanism with smoking. Well, how else can we relieve our stress? And I kind of let the patient dictate what that answer is for them. Some of them say, well, phoning a friend might be really helpful for me. Or Some of them also say, well, maybe limiting my time with some certain people, friends or family, because they're a smoker and I'm more likely to smoke around them. Okay. What else could we do to relieve our stress? Maybe it's exercise, or maybe it's fueling our body with the things that it needs. What about that social aspect of things? How can we change your social environment to make you more likely to stick to quitting? Is it we need to change where you smoke, where you're acceptable to smoke? Instead of smoking in your whole house, we're going to limit it maybe to outside on the porch. Or if you know that you're going to an event that has a lot of people that smoke there, maybe we're going to try to limit our time at that event so that way you can be more successful in your quit, certainly in the first couple of days. So I encourage you guys to do this decisional balance exercise at home or with your loved ones or whoever it is. This is also very good for other things, not just smoking. I utilize this exercise for physical activity with our patients as well. But really good one to start with. Where's your motivation with this? Another good exercise that we can do is this. It's called scaling. Scaling is an exercise that we use to help identify gaps in our quit plan. It can also be used for those of us who wish to stay quit. So if we work through the questions here, they're all relating to the scale on the bottom, a 0 through 10, 0 being not really important at all to us, 10 being extremely important. How important is it to you to quit smoking? And some patients, depending on where they're at, will fall anywhere on the scale from, it's kind of important to me, or most of them fall towards the top. Most people know that it is important to quit smoking. Again, it's the 70% of smokers want to quit because they know it's really important for your health. But how confident are you that you can quit? Are you maybe around a 5? Well, why are we a 5? What could make us more confident? What would make us a 7? So those are some of the questions to ask yourself. What about how ready are you to quit? Are you really ready? You're ready yesterday. We should have made this decision and we should already be going on it. Or you're not ready. We need a little bit more time. We need some more, maybe we need more resources, or maybe we need more knowledge behind the quit, or maybe we need additional support and maybe some nicotine replacement therapies. You can also ask yourself these questions, and how important is it for you to stay quit? Or how confident are you in staying quit? How ready are you to stay quit? So go through these questions and see on that scale where you fall. And of course, like our video said, we're going to try to move you closer to that 10 mark on all of these. A little break here in our conversation. Did you know that the most leading preventable cause of death in the US is smoking? Smoking causes most of the preventable deaths in the US. And a pack a day habit, I actually had to update this because of all of our inflation. A pack a day habit used to cost us, I think, around $1,800. Now it's costing us $2,292 per year. And I'm sure that number will just keep on the rise. Not necessarily a bad thing for those of us in the healthcare field, but certainly not a good thing for those of us who still are addicted to nicotine. And then the last point here, nicotine changes the way synapses are formed and can harm the parts of our brain that function with control, attention, and learning. So no wonder why it's really difficult to quit smoking, because we're trying to make these decisions and have the control and the attention to make this very specific movement, but the nicotine is changing your brain chemistry and really changing sort of how you act and how you function. So no wonder why it's very difficult, but we're going to give you some tools that we can overcome this. I have another video here. I'm not into scare tacticking anyone to quit smoking, but it is helpful to know sort of what we're putting into our body. So I have a short video here. I think it's about 6 minutes about what's inside a cigarette, over 4,000 identified chemicals. And I think maybe now there are even more unidentified chemicals that are in a US cigarette. So let's take a quick peek here at our video.
So deadly. Why is it so popular?
A cigarette is a months out of a cigarette is nicotine.
Nicotine may be the addictive product, but other cigarette components that accompany it are actually more lethal. So what's inside a U.S. blended cigarette? Tobaccos, flue-cured, burley, and oriental, only make up about half the cigarette. The rest is known as constituted tobacco, is made from a mixture of tobacco dust swept from the factory floor and reclaimed cigarettes that have passed their prime and have been sent back to the factory. It all goes into a giant
Beat up, it's constantly extracted like a tea bag. Well, that means I removed all the chemicals, all the solubles, and then it's cooled. This is the chemical reaction.
The resulting solution is known as the mother liquor.
So you have this mother liquor, which is an aqueous-based system, water-based system, and we now add a host of chemicals, phosphate, urea, used to deal with nicotine manipulation. The other to use as ameliorants. If you try to smoke a cigarette without additives, how do I smooth it? Chocolate, glycerol. Sounds all like things I buy in a grocery store, isn't it? Or foodstuffs.
Reacted, the mother liquor solution is applied to paper made from the ground stems, oval, and reclaim. This paper is dried and shredded and is known as reconstituted tobacco, or recon. It will make up 30% of the cigarette's contents. When it's smoked, the ammonia in the recon will enhance the absorption of nicotine in the smoker's body.
That ball and chain off, and now we start changing its shape. We call freebase nicotine. Freebasing nicotine is much the same as freebasing cocaine. Increases potency, increases delivery.
Expanded tobacco, a puff tobacco product that has been expanded with carbon dioxide, is also part of the blend to act as a filler. So, cigarette. 20% is expanded tobacco, stems, and reclaim, tobacco from returned cigarettes, and 30% is recon. The other 50% is tobacco, which is also treated with sugar to mask the bitter taste of nicotine and enhance its absorption into a smoker's body. Tobacco, stems, reconstituted, reclaim, and expanded tobacco are mixed in a bulking bin the size of a bus. It's all cut to 1/28 of an inch slices called rag, and pneumatically moved to the cigarette fabrication side of the plant. There, the rag will be rolled in paper, glued, joined with filters made from cellulose acetate, and packaged. This process occurs at a rate of roughly 20,000 cigarettes per minute, sometimes 24 hours a day. Long before oval, casings, and recon, cigarettes had humble origins.
I like that video because it does show you really what all is in our cigarettes, and it's a lot of stuff.
So these are disclosures
oh
as every
gosh.
physician. These are what I
One moment,
want
let
to
me
make sure
see.
you realize.
He's still
I'm not
talking.
going to be speaking much about medication this morning, but what I am going to speak about.
I'm not sure what he's going to speak about, but that's probably for another time. So as we move on here, how does this cigarette smoke, or how does the nicotine really affect our body? The effects of a normal non-smoking body, your hemoglobin, which is in your red blood cells, they bind to oxygen and carbon dioxide. So oxygen, of course, is sort of an energy source for our cells, and then the carbon dioxide is sort of a waste byproduct that is taken to the lungs and then exhaled. But whenever we introduce cigarette smoking, the carbon monoxide is introduced into our system, and then that has a really high affinity for binding with the hemoglobin, thus making it harder for oxygen and carbon dioxide to bind to give your cells energy and then to exhale that wasteful carbon dioxide. So it does really have a profound effect. And in fact, smoking really affects every organ in our body. It can affect our heart. It can increase the likelihood for atherosclerosis and increase your risk of heart attack and stroke, cause damage to your heart and your blood vessels, make it more likely that these things will happen. And this is even any amount of smoking. It's even occasional smoking can increase this risk. So we're not talking, the risk increases once you hit a pack a day. Even if you're smoking a couple of cigarettes a day or maybe every other day, we're still increasing our risk for this. And of course, I don't need to be the first one to tell you that smoking affects your lungs, causes damage to the airways and the air sacs in our lungs that are responsible for oxygen exchange. The tar paralyzes the cilia, finger-like protuberances on our breathing airways that help our lungs clear themselves. So when those cilia get paralyzed, things aren't moving through our system like they should. We're not able to cough up maybe mucus or get good immunity in our system. We can't keep anything out that needs to be out as well. So the link to disease is really profound. Carcinogens that are present in our smoke of tobacco products really have an important role in altering the genome of immune cells, and whether by changing and implanting chemical changes in the cellular DNA, or even by introducing irreversible genetic damage to our cells. It changes our immunity, changes our cellular DNA, and can result in things like cancer and emphysema. Of course, we talked heart and vascular disease, and a slew of other things that can be really life-changing for us. So how can we further support our quit? We talked a little bit earlier about what are the things that we need: more resources, more support, more knowledge, maybe modification of our behaviors to really make our quit attempt successful. So some of the nicotine replacement therapies that are approved by the FDA for use in patients that are wanting to quit smoking. We have the patch, which is, I think, the most common one that we hear about. The patch is over the counter, the gum as well. The lozenges, maybe a little less common, but then really the two less common ones that I've really not even seen in patients are the nose spray and inhaler. We'll talk about all of these things. We'll also talk about Wellbutrin and some prescribed pill form of helping us quit smoking. So let's dive in a little bit here. The nicotine replacement therapy, the patches, they're long acting. They, like I said, are over the counter. They're time released, so they can last for 24 hours. It does take about 30 minutes for them to kick in. So we always suggest that our patient wake up first thing in the morning and put that patch on immediately, especially if the hardest cigarette for you is the first one in the morning, which is usually what people say. That tells us that you have a very high nicotine addiction. If you're waking up and pretty much the first thing that you're doing is reaching for that cigarette, make sure you roll out of bed and get that patch put on as soon as possible, so that way that can kick in and give you that relief that you're looking for. There is a step down protocol. There are different milligram patches dosed out depending on how much a day you're smoking. So if you're smoking at least 1 to 1.5 packs a day, we always suggest starting with the 21 milligrams. And then as you work through the program, when you feel comfortable, we can step you down to 14 to 7, and then ultimately to nothing. Can be worn anywhere on your upper body. Usually people choose the deltoid area of the upper arm. Can also be worn on the back. Our preference is not wearing it over the heart, but you can change the position of the patch day to day. Major side effect is some skin irritation from where that patch sits on your skin. That's why we suggest maybe switching arms each day. But there is a myth related to the patch, and a lot of people think that the patch causes a heart attack, especially if you smoke with the patch. So this is definitely proven false. In fact, the risk is far more increased with you continuing smoking versus you maybe smoking one and wearing the patch at the same time. Your risk just smoking that cigarette is far more increased than smoking with the patch. So the truth is that 21 milligrams might not be strong enough for you to overcome your cravings. We might have to maybe put 2 patches on, and the FDA improves 63 milligrams of nicotine replacement therapy in the patch form. So it might not be something that if you smoke maybe 2 packs a day, maybe we need to increase that a little bit more so we can adjust your dosage of nicotine. Other options for us are the gum and the lozenger. Again, the gum is probably more apparent in most people. These are both over the counter. Takes about 5 minutes to kick in. So these ones are more of a short acting. They must be chewed 3 to 4 times and then park it in between the lip and the gum for about 20 minutes. We can repeat this for up to 2 hours. Once you start feeling that tingly sensation, whenever you start chewing the gum, you park it in your lip. If you feel that go away, you can re-chew that a couple of times and then park it again, but it is not used like normal chewing gum. And the reason behind that, if we're chewing that like regular chewing gum, that nicotine is now not being absorbed in your mouth. What it is going into your stomach, and then that can cause all kinds of issues like heartburn or hiccups or nausea. And of course, you're getting less nicotine to your brain, which is where it needs to go. The perks of this are they are self-regulated. They come in 4 milligram dosage and 2 milligram strength. Usually we suggest the 4 milligrams. Again, if you're smoking about that pack a day. So the 4 milligrams, you can take up to 16 pieces a day. And again, chew, 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 park. And whenever you're feeling those cravings, that's really when we're going to go and reach for the nicotine gum. Now, this can be used in conjunction with the patch. And in fact, it is more successful whenever you use a long acting and a short acting form of nicotine replacement. Again, these are all over the counter. The lozenger is used in a very similar way. Of course, instead of chewing on it, you're sucking on it and parking it in between your cheek. Sometimes the lozenger can give you maybe some more irritation on the tongue than what the nicotine gum does. If you've tried the gum in the past, maybe try the lozenger instead or vice versa, but I would highly recommend either of these products. There are other forms of short-acting nicotine replacement therapy. Those are the nasal spray and the inhaler. Now, the nasal spray, the pros are, it's the most rapid delivery of nicotine. It can also be used with the patch, but it does come along with a lot of cons. Things like nose irritation, because you are ultimately using that similar to an allergy nose spray. Putting that in your nose and you're spraying it, it's getting released into the soft tissue around the nasal passage. The other issue is you have to remember to use it often and regularly. This is required by a prescription, and it's also a very visible use. Whenever you have the patch or maybe the gum in, not many other people would really identify you as, oh, well, that person's trying to quit smoking, versus you have a nicotine inhaler or the nasal spray might prompt some more questions from people. So it depends on, what you're interested in. If you have asthma, this one is one that you want to consult a doctor with too. Of course you will be, because it'll be by prescription, but that's another reason why I don't see a lot of patients that really use the nicotine nasal spray. Now the inhaler, you'll see on the right-hand side of the screen, the very right-hand item, that is the inhaler itself. The item on the left that says Nicotrol inhaler, that's sort of the packaging for it all. And then the thing in the middle, those are cartridges that release the nicotine. So one of those cartridges is used for about 20 minutes. So around the whole day, we're using about 6 of those. So that one pack that you see there, that would last for a day. And you're putting one cartridge in and you're really not using it like an inhaler. You're more so sort of sucking it like you would be sucking something out of a straw. So you put that inhaler in your mouth and you take a very short breath in. You're not trying to inhale the nicotine into the lungs, but rather you're just trying to get that nicotine into your mouth so that way it can be released into your gums and get to the brain, sort of like the gum does. Now for this nicotine inhaler, you can't eat or drink 15 minutes before using it. You also can't eat or drink while you're using it. This is definitely not an e-cigarette though. The e-cigarettes, those are the ones that are inhaled into the lungs. That is not a good form of quitting smoking. We'll talk about that here in just a moment, but I find a lot more issues with the Nicotrol inhaler. If it's something you're interested in, by all means, talk with your doctor. But I do think maybe the patch and the gum would be more to explore on the first base. So let's talk a little bit about that e-cigarette. Like I said, not an effective way to quit smoking. They contain high concentrations of nicotine. It's just as addictive as regular cigarettes. About 1 in 20 Americans vape. And the really staggering fact is youth e-cigarette use has increased by 1,800%. That is just an astonishing number that we are trying to actively combat. And the reason for that is, I think why most people started smoking is it's the social impact. Most kids think it's a very cool thing. It's a way of rebelling, or maybe it's a way of fitting in. And it is a little more socially acceptable because you're not smelling the normal smoke of a cigarette. You are smelling maybe cotton candy or something sweet. And it's very easy to conceal and do anywhere. As you can see at the bottom here, of course, you have like an e-pipe, which it definitely wouldn't be as easy to conceal. But over to the right, you see these tiny little, they look like USB drives. And these are in fact vapes. And it's so easy for a student to have in their pocket and take with them throughout their day in their classroom and do some hits on the way to class without really anyone knowing. So that will be our next battle, is fighting the e-cigarette use. But it is definitely not a good way to quit smoking. We're not identifying the behavioral use. We're also not identifying the nicotine addiction itself. So let's move on. What are some of the pills that maybe we can use that might be helpful to us? The first one is bupropion. This one's also called Zyban or Wellbutrin. You can use all of those names sort of synonymously. It was created in 1969 and it was approved in 1985 for the treatment of depression. And along the way, the scientists discovered that, hey, all of our patients that were depressed are getting a little bit better, but they also quit smoking. So I wonder if this could be used for something else. So they started marketing this more for patients that might also have some depression, but they also want to quit smoking. So it's sort of a win-win for most of us. Smoking can continue during the first week of taking the medication, but then the quit date should be set for sometime during the second week. Contraindicated for people with seizure disorders. Of course, this will come along from a prescription with your doctor. So definitely speak with your doctor about this if you think it might be something you'd be willing to try. Some of the major side effects are agitation, dry mouth, sort of feeling a little out of it, weight loss, which is actually counterintuitive to the weight gain that we might see from quitting smoking. So some of it's good, some of it's pretty normal. When we start quitting in the first week, we all might feel a little agitated. You might sort of feel a little bit out of it. So some of the symptoms come along with a quit anyway. Depends on, if you have seizure disorders, if you're contraindicated, or if this is something you're interested in trying. So speak with your doctor about that. There's also Chantix, which I think is one of the more marketable things. Chantix does not contain nicotine. What it is, it actually acts at the sites of the brain affected by nicotine to do two main things. One is mimic the effect of nicotine, sort of staving off the cravings. And then also, whenever it is used with nicotine, it's blocking those pleasure centers. So it's blocking that effect that reinforces you to go back for another cigarette. 44% of people are successful when compared to other methods when using Chantix. And of course, it was approved by the FDA in 2006. So it might be something that you'd be interested in talking to the doctor about this as well. See what ones may be more appropriate for you. Then we get into what is our quit plan. So how do we start? We're going to start, of course, by picking a date. When is a good date for you? Of course, maybe planning a day that you might be a little bit busier and you will be less prone to sitting around twiddling your thumbs and just thinking about that cigarette. Or maybe there's a really important date ahead of you that you really want to be quit by. Set that quit date sometime in the near future and decide what method are you going to use. Do we need to do a little bit of research or planning ahead of that? Do we need to reach out to the doctor about one of those nicotine replacement therapies? Do we need to go to the store and buy one of the over-the-counter medications like the patch or the gum for us? Do we need to make a doctor's appointment to do all of this thing? Maybe do we need to sign up for a class that can give you more emotional support? Record your habits for a week. This one's really key because this shows you where you've started. So if you remember from the beginning there, where you're at in this journey, are you pre-contemplative, contemplative? Are you in that action phase, the maintenance phase? Where are you along there? Know what your triggers are to smoking. What are your biggest barriers? What are those things in that decisional balance exercise that we did that were really stopping you from committing fully to this? And designating those areas, sort of the safe places in your home that you will not smoke, and putting the areas that you will smoke into a very small little box. Have a non-smoking mantra. This mantra is really important because this is truly more specific to you. This is why you want to quit. You want to quit so that way you can have your grandbabies over or drive them in the car without worrying about exposing them to smoke. or you want to never smoke again because I'm looking forward to having a healthier life in 2023. Whatever it is, maybe write it on a little card, keep it with you, write it in your phone, whatever works for you, put it up on your refrigerator, and remember those reasons why you are committing to this anyway. Why did you end up in this chat today with us? So some of that comes along with overcoming our major obstacles, like withdrawal, psychological issues, stress, and weight gain. We've talked a little bit about some of these, but let's go a little bit deeper. So withdrawal, the important thing about withdrawal is most of these symptoms that we experience from withdrawal are very temporary. And the cravings that we think about, they really only last about 10 minutes. So if we can do something else during that time, maybe distract ourselves, then that 10 minutes is going to be come and gone as fast as it came. And then we're going to be one step closer to fully committing to our quit. So we use the 4 Ds. One of them is deep breath, which sort of simulates like you're taking a deep breath in and inhaling that cigarette, except you're inhaling fresh air. So first D is deep breathe in through the nose and out through your mouth. The second is drink water. That one's really key because that helps flush out any of those toxins in your body. And of course, we all probably need a little bit more water. Do something else. Like I said, distract, delay for 10 minutes. Those two kind of go hand in hand. Find something that can keep you busy, whether it's mentally, physically, or both of those things. And then listed beneath that are the common symptoms that we experience from that withdrawal. Now, when we talk about sort of the peak of withdrawal, a lot of people think that that might be, for weeks we're experiencing these withdrawal symptoms, but truly for the first maybe 3 or 4 days are really when we're going to start peaking all of these withdrawal symptoms. And then after that, they start to go away because we're turning off those receptors in our brain that say we need a cigarette. And instead, when you start to turn some of those off, you get less symptoms from this. But if we go back to smoking those cigarettes, say on day 4, we have 1 cigarette because we just cannot stand it, those receptors start going off again. So we're sort of taking backward steps. So we can just keep stepping forward along that line, knowing, okay, day 3 and 4, those are going to be my tough days. As soon as I get past that, it's going to get easier. And these symptoms are only temporary. So the other key, like we said, is sort of behaviorally breaking the habits. So drinking water, which is one of our 4 Ds, carrying low calorie food items, sort of those healthy snacks, because like we said, nicotine's that appetite suppressant. And without that, we might experience some increase in our hunger. So carrying healthy snacks along with us will be a good way to combat some of that weight gain. Being active, we all should aim for 10,000 steps a day. That is also going to keep our brain busy and our body busy. Deep breathing, utilizing those 4 Ds, and avoiding those trigger situations, or we call those the high risk situations for you. How can we deal more with our stress? We talked a little bit about that earlier. Maybe it's using some physical activity or relaxation exercises, or maybe it's just even constructive and assertive sort of thinking and behavior. So constructive thinking would be more of, pardon me, constructive thinking would be more not I have to quit, but I want to quit. Because ultimately, this decision is up to you. And the reason that you're quitting is because you want to, not necessarily because you have to, but because it is something that you're interested in doing. And assertive behavior really helps us dealing with our stressors relating to maybe time and people. So, I can't go to this situation. I can't go to this party because I know that there are going to be situations there that I deem high risk for me. So instead of, just saying, oh, yes, I'll go because, I don't want to let anybody down, saying I will go because I want to, but I'm going to stay away from this situation and I'm going to leave early. So that way I don't increase my risk of maybe picking up that cigarette later in the night. So we talked a little more about weight gain as well. Common things that we gain, common reasons why we gain weight is a decrease in our metabolism. And then we're substituting food for cigarettes. So instead of lifting that cigarette up to your mouth 300 times a day, now what we're doing is we're replacing that with food. And as long as we're replacing that with the healthy things, the low calorie items, that's okay. As if we're not reaching for maybe those McDonald's Big Macs all the time. And then, of course, eating out of boredom, because in the placement of cigarettes, what are we going to do? Now we have about 5 minutes maybe 12 times a day that we need to fill with something. How to combat weight gain, watching portion sizes, keeping those healthy foods on hand, and increasing our physical activity. So what's the whole reason for this? What are the benefits of quitting? Whether you know like what the benefit that you are reaching for is, but this is more of the physiological changes that you can expect in your body. Within 20 minutes, your blood pressure and your body temp return to normal. Within 8 hours, your carbon monoxide levels in your blood drop to normal. So remember that how your oxygen is binding with your red blood cells or your hemoglobin on your red blood cells. That's going to improve within just 8 hours. So you might feel a little more energized within 8 hours of quitting. 24 hours, your risk of heart attack decreases. 2 to 3 months, circulation improves. Lung function increases up to 30% of what you were before. Between 1 to 9 months, coughing, sinus congestion, fatigue all decrease. That cilia, the thing that protrudes on your breathing airways, those start to wake up again. They start to go back to normal functioning, keeping things out of the system and also getting things up and out. What about the long term? So we talked about some of the short term things down there at the bottom, but as you travel along this road, what are some of the things that you can anticipate? So after 1 year of quitting, your risk of coronary artery disease is cut in half. It's 50% less than where you are right now. After 5 years, your risk of cancer, mouth, throat, esophagus, and bladder are cut in half. After 10 years, you're half as likely to die from lung cancer. Your risk of larynx and pancreatic cancers decrease. And then after 15 years, your risk of coronary artery disease is the same as a non-smoker. Truly wonderful progress that you can look forward to along your way. So how do we ensure that we can stay quit? We've made the decision, we're ready to go, but we're a little nervous about how can we stay quit. So plan ahead for your response to those crises. Remember your smoking mantra, why you decided to quit in the first place. And I really like this next one. It's avoiding one cigarette and you'll avoid all the others. So we can just say the one that you're craving right now, we're just going to avoid that one. If I can avoid this one, we're going to be better off. You avoid one cigarette and you avoid all the others. Try to deal with obstacles in other ways. We talked a little bit about stress management and increasing our coping mechanisms, focusing on the long-term benefits, your energy, money, health. There are some resources, of course, that you can utilize if you're really struggling to stay quit. So Become an X is one of the websites that we refer our patients to often. Of course, the CDC has a lot of good resources. Here at Aultman, we also have our Give It Up program, which I'll talk about here in just a moment. There are different applications on your phone that you can utilize as well to sort of track and help you stay quit. So some of the common ones are Smoke Free, Quit Now, and Quit Start. Some of these are for iPhone and Android, some of them specifically for each phone. Explore some of these applications, see what works for you. If you're not really sure where to start in your phone in the App Store, you can just type in quit smoking and there will be all kinds of different applications that pop up. And most of these are free. You won't have to pay for an application to help you quit smoking. So Aultman's Give It Up Tobacco Cessation Program is a group program. It's led by a tobacco treatment specialist like myself. It is one course a week for 6 weeks. So in as little as 6 hours, we can really help you build your quit plan that's specific to you. We can even help supply you with nicotine replacement therapy. We can give you patches or gum that is specific to you, help you walk through maybe the obstacles with those and with your quit plan. If this is something you're interested in, you can always call that number listed there, 330-363-5403, and talk with a member of our cardiac and pulmonary rehab staff to get established with the program. You can also go to altman.org/giveitup to sign up for one of our classes. I know we have 2 classes starting this week and more to come in the fall. So if that's something you're interested in, please don't be afraid to reach out. And we have classes that are in person. We have classes that are virtually, so you don't even have to leave your home. Reach out if this is something interesting for you. Even if you come one time and you say, you know what, I learned a little bit, but I think that's okay for now. That's okay. That's progressing you along that pathway that we were talking about, where you are, what stage are you in.